So today we're going to talk about leprosy. Leprosy is a very interesting condition. It's been around for ages and ages. So I thought to myself, let's learn about it because I find it very fascinating. And I think those of us who've heard about it may not know the specifics because it's such an old disease, but it is present in a lot of areas in the world. What is leprosy? Well, leprosy comes from the bacteria Mycobacterium leprae. Now, there is another bacteria that was discovered relatively recently, but we're going to talk about this one. This is the main culprit. What's important is 95% of people are actually asymptomatic. They don't show symptoms. Only a small percentage of people actually show symptoms. You can find this in sub-Saharan Africa, Asia, and some other places. It primarily affects the skin, but over time, if it's not treated, it can become much more serious. Now, it is understood that this can be transmitted from respiratory droplets from your nose and mouth. Now, there are three types: tuberculoid, which is mild symptoms with a few sores. These sores being these right here. Lepromatous, I think that's how you pronounce it. Now, this can be widespread sores, and this is when it can spread to the nerves, the skin, the organs. Leprosy can dramatically affect the nerves, affecting sensation of all sorts of other things. Now, this is a result of a poor immune response. The tuberculoid is a result of a pretty good immune response. And the borderline type is a mixture of both. So this person right here has a much more advanced staged leprosy. This results from lack of treatment. I don't know her situation, but you can see the various sores that occur from this condition. This is also one of the reasons why there is so much stigma, at least in our history. We'll talk about that towards the end of this discussion. Diagnosis and identification. Leprosy is an interesting condition in that in its initial stages, it's not easy to diagnose, but the symptoms. So patches of skin. Now these can be red, this can be loss of pigment. And so over here in the last picture, we see that this person is darker skinned, but they have these patches that have lost pigment. Decreased nerve sensation. I mentioned that the nerves can be attacked by this bacteria, in some cases completely removing the feeling in the skin. A numbness and tingling in the hands, feet, arms, and legs. Painless wounds / burns on the hands and feet. Thick and stiff skin, a loss of eyelashes, eyebrows, enlarged peripheral nerves. This is a case of someone with a advanced stage leprosy. The same case with this guy right here. In the advanced stages, there are things like paralysis, loss of vision, nasal disfigurement. If you recall the last picture I showed you guys, this person's nose was very disfigured. That's a late stage leprosy. Permanent damage to the nose, the feet. In this case, this person right here has permanent damage. The shortening of the fingers, I just showed you that right here, and the toes. So I want to reiterate, a lot of the pictures we see of leprosy are in the advanced stages, and a lot of that is because of lack of treatment, especially in the world today in the developing countries. Things like the World Health Organization are working on treating leprosy because it is still occurring. Now, the time between symptoms can be about 3 to 5 years. At least that's the time from infection to showing symptoms. 20 years and more have been reported, which is really, really interesting. So this pathogen can lie latent for a long time before you even start seeing symptoms of the infection. What's great about leprosy is that there is a cure. This cure kills the pathogen. It's something called multi-drug therapy. You find this in HIV medications. If you look at a medication like Biktarvy, for example, it's not just one medication, it's kind of a combination of a few medications that work at keeping this virus from inflicting a lot of damage. Now, this multi-drug therapy consists of the molecules dapsone, or the drugs dapsone, clofazimine, and rifampicin. Outside of looking very, very nice as far as the structures are concerned, these three drugs kill leprosy, and they're very, very effective when they're given in the right amount of time. So you have a couple different cases, I guess. You have PB, I think that's bacillary, and I think this is multibacillary. Anyway, the PB cases consist of 1 to 5 skin lesions, And when they take a sample and look at it under a microscope, there's no bacteria that they see. It takes about 6 months of treatment with these drugs in this specific case to cure the patient. Now, in the MB cases, this has more than 5 skin lesions. Nerves can be involved, so loss of sensation. And when you look at a sample under the microscope, you see the rod-shaped bacteria. And this takes about 12 months of treatment to kill the pathogen. Real quick, I just wanted to mention the social stigma. Now, this has been going on since antiquity, forever. In the past, you'd see leper colonies. These people who had leprosy would be considered unclean. Oftentimes in their socioeconomic class, they're very poor, and you can find these people in developing countries. And at least from the European perspective, and really other perspectives, those with leprosy were seen as being inferior. And this is one really interesting historical fact. I'm not a historian. I believe when the people who had leprosy would move through towns, they would announce themselves by ringing a bell. I think this was in the medieval period, so people could know they were passing by, and with the hopes of getting some gifts or food or something like that. Let's go through the summary and review what we learned. We spoke about leprosy being caused by Mycobacterium leprae. 95% are asymptomatic. You can find it in developing countries. It primarily affects the skin. You have tuberculoid, lepromatous, and borderline leprosy, all with different signs and symptoms. The symptoms can include patches of skin with a loss of pigment, decreased sensation, painless wounds, thick or stiff skin. In the advanced stages, nasal disfigurement, permanent damage, paralysis, and all sorts of other things. And from infection to symptoms showing, it can take 3 to 5 years to occur. We then closed out talking about there is a cure. It is a multi-drug therapy with 3 unique drugs, and depending on the case, you will need to be treated for 6 months or a year to kill the pathogen. Then we briefly mentioned the social stigma of those who had leprosy. They were considered unclean, poor, and inferior. So that's all I got. I hope you guys learned a lot from this video. I was relatively aware of leprosy, but it was really cool learning more about the specifics, especially the drug treatment and therapy and the different types of leprosy. So as always, thank you guys so much for watching and listening. Please like, comment, and subscribe. Tell your friends, and I'll be back soon with another video.